It's time. 各位同学，大家好。Hello, everybody. It's time we start today's presentation. Okay. As we know, we are a doctor, and we will be nursing or hygienist or in medical staff for help a patient. So we have the original intention with love. So today my topic, we're talking about the Taiwan Medical Mission working in Africa. Okay. I'm Dr. Qi Lixing. This year I graduated from the Taiwan Medical University for the PhD student. Okay. I will share our medical mission operated by TMU, and we work in Africa since the 1992 to 2012, and so far, and until this year, we still have the secret mission to Africa. Okay. So let's celebrate the 2021 and Merry Christmas in the last year. That's because the COVID infection epidemic spread all over the world, but still in Africa we can see the giraffe, the tree, taking the food from the tree, and also we see the kind of Santa Claus riding the impala in Africa to sending a gift to the children. So we have the official from the Taiwan government with the true friend. It means that Taiwan can help for the African people, for all over the world.
One misconception of meditation is that if you're meditating, your mind will be blank. You can't make your mind blank.
Let's go.
As the saying goes, show me your friends and I'll show you your future.
A true friend.
There's someone who will never abandon you, who has remained by your side for decades, and to whose presence you are so accustomed to, that it's only when you turn your head you find she's always been there, helping you on your way. That's a true friend. There's someone who treats you as an individual, regardless of your race, culture, religion, or circumstances, who always respects you. That's a true friend. There's someone who never wants anything from you, whose only concern is how to offer you more to enrich your life so that you can face the challenges thrown at you by an ever-changing world. That's a true friend. When life is going well, you only sense her presence vaguely. When adversity presents itself, however, you see clearly as she reaches out her hand to you. But when she is faced with adversity, you are bound by tacitly agreed rules and leave her to struggle by herself. Life is not about winning the race. Instead, it's about how we help one another over the finish line.
Operation.
Love is but a word until someone's presence gives it meaning. You embody that meaning. Perhaps she deserves an invitation, a seat at the table, for she leaves no one behind, and thus shall not be left alone. Taiwan can help.
Actually, Taiwan is helping. So there's a photograph on the video. That's the time I'm working in the Santome Principal as the Taiwan Medical Mission. So this is my patient, Oswaldo. We could talk about his story later. It is Santome Principal in West Africa, 西非的圣多美 Principal. I'm working there for 1 year. This is my Facebook QR code. You can see the whole garden are retired. This is me. The subtitle of today will be the What Healthcare Going in Africa. So this story by the Taiwan Medical Mission. We working there in the Kingdom of Swaziland, 南非的斯瓦基兰。San Tome the Principe, 西非圣多美, and in the future will be the Republic of Somaliland, 索马利兰，东非。Okay. after working in the 3 Africa medical mission back home in Taiwan for the DOH 牙医的到宅服务 and also for the other research and working and with acupuncture, I'm an oral maxillofacial surgeon. Okay. After today's lecture, we will know about the 3 questions. So the question we're raising, put it here, keep in mind. First, what is which one the infection disease will be the most common in developing country, especially in Africa? Which kind? A human can transmit to human, okay? And which one of them not so easy to transmit to medical staff? Because we're working there to help them, and of course we were afraid about if the problem, the disease was transmitted to us, it would endanger. And which one will be cured? That meaning which one cannot be cured. Okay, the answer will be on the slide. The first one we're talking about Plasmodium falciparum is a kind of the malaria 疟疾. The malaria disease is a kind of parasite inside our RBC, red cell. And the parasite, in the name of the parasite, Plasmodium falciparum, and this parasite, this worm, will be very small. It's less than 1 cell in the RBC of human. And the parasite will be biting and transmitted by the mosquito, especially a kind of the mosquito, 疟疾蚊子, 疟蚊. Okay, so we can show the map, and we're mapped with it says the equator line, 赤道, and the Taiwan is right here, the Asian, the Indian, Russia over here, the Ukraine is around here. Okay, and the whole Africa, the middle of the Africa, and we can see the color. The more red the color is, the more malaria infection in that region. So the San Tome Principe around here. Okay. The other map on the Africa, we can see there's malaria stable, unstable. It means the more red is more dangerous and more risk got the malaria. And until now, the malaria cannot be prevented by any vaccine, not like the COVID-19 virus. So how we can deal with that? We must prevention the mosquito bite, okay? Because we know the mosquito will carry the parasite, and when he bites us, he will go into the parasite will go into our body to infect our blood cell. Okay, so the mosquito bite must be prevented. If we prevent that, we will prevent escape from the malaria infection. If we got a fever, we have the rapid test. We can take in the blood, put it on here. It run through to see the result. If only one control and negative for the other band, bingo, we are free from the malaria. We could just only fever, get a acetaminophen, go to sleep, and then next day will be okay. But if the test bar with the positive, so we got the rapid test positive for you got infection by the malaria. So how we could do? We have the good drug since the 2015. There's a 青蒿素, artemisinin, the 青蒿素 or quinine. They are the good choice of drug to treatment the patient got malaria in Africa. Okay, the mosquito need to feed in the egg, the baby in the water. So if the water in Africa, we know that Africa is short of the water. So the water tank, water dam is for feeding the people. The water also can feed the mosquito baby. So the mosquito can grow in together with people. So it's why malaria is so so many in this region. Okay, so we're working in the Eswatini in right here, so Swaziland, and Captain Babani. But in Babani, there's no mosquito because the elevation is high. The altitude is higher than 1,000, so mosquito cannot fly so high. And the others in the TMM Principal region is also high. You can see the red here, the small island. So there's too much mosquito. So it's a pandemic region for the malaria. And the other country in Hargeisa in Somaliland in East Africa, 东非的角, right here. Hargeisa is not so hot. It's just a red or yellow one, so it's a minimal risk for about the malaria. So we see the different region in Africa with a different risk factor of the malaria infection. 地方不同，环境不同，所以风险度不一样。Okay, so in my previous experience, I'm going through from Taiwan to Swaziland or Eswatini for the country of the Taiwan Medical Mission. After that, we go to the next in the West Africa in Sao Tome and Principe, and third one in Somaliland, the Medical Mission. We will go to there in this year, maybe 2 months later. So you will not see me in Taipei later. So in the first, we will go to the Eswatini. It's very far from Taiwan. Okay, we traveled from Taiwan, cross the Indian Ocean, and go to the South Africa, and go fly into the Swaziland right here. It's very small, half size of Taiwan. Okay. That's in the year 2009. I went to Swaziland. There's many mountains in this country. I like to walking around there. Okay, so what about the Swaziland, the healthcare there? You can see it's a chief of the Swaziland, 酋长. This is His Majesty, the King Swazi III, 斯瓦基兰的国王，现任国王. Okay. In 2015, he went to TMU and see our president, superintendent, and our president in our hospital. He is one of his wife and his children, his son, the prince, 王子. Okay. So still, in June 2012, our previous president Ma Ying-jeou, he went to Swaziland to walking and running with him, His Majesty. The Taiwan Medical Mission is a scenario, a 场景 for the outreach. There's the Chief Dr. Du, the chief, our head of our medical mission, and the 外交替代役男, they are all there. And our medical doctor is Dr. Liao. He's a local staff. Okay. It's Dr. Zhang, 神经内科 neurologist. As the children standing there with a big tent, and it's early morning, but the sunshine is very big. The children of his family in the primary school, they are waiting for us to visit them, to check health, the body, to oral health, the carries, something like that. Okay, so as that day I say, the African people, they are walking ahead, keep moving, even not so fast than Taiwan does. Okay, 他们走的脚步没有我们快，但他们keep going, 往前继续走. It's a reed dance. The young girl of the Swaziland people, they raising the plant, go to the king mother's home to repair the house for the herd. Okay, it's one of our 外交替代役男, our TOs, our young overseas service boys. is working here. Okay, so before we go into Africa, how our imagination to see what present in the Africa? We see, oh, maybe the giraffe, 长颈鹿 will be standing around our house, or they may be behind inside our garden. 在我们的院子里，到处有长颈鹿 walking around. In the morning, he will go through the window to see, to wake you up. No, never. Our boy or girl is thinking like that in Africa. But actually, we need to go to the wild animal park, 野生动物园, to see them. They are living far away from people. We cannot living together. Okay, so there's also in the primary school in 2009, and the other day in 2014, that we in the same school with the same staff and with the different children. They are graduated from that since 5 years past. Okay, they must be graduated like you. Okay, it's our lunchbox in Babani Government Hospital. As that the day we're working there since 2009, we eat that for the lunch from the restaurant of the hospital, and there's the beef. The cow will always walking slowly, cross the road to searching the grass, searching the food. Okay, this is our home in Switzerland in 2010. It's my wife Candy. That's the moment. Before that in 2009, she's my girlfriend. She was my girlfriend, and after that, she's my wife, becoming my wife until now. At our home, in the morning, weekend, she will cooking something, the cheese, MMZ, a kind of milk, yogurt, and toast and something, food, vegetable, or beef for me. Sometimes we will the ambassador 大使，中华民国驻斯瓦基兰大使。The ambassador Tsai will invite us to the Chinese restaurant there. You see, our staff, the Dr. Dubé and nurse and I don't know her name, we were using a chopstick to eating as Taiwanese people. Okay, we training them doing like that. 他们必须要会用筷子，不然的话他们没办法吃东西。In Chinese restaurant. Okay, so it's the scenario in the OPD, outpatient department. The doctor, the staff of our medical mission, the Dr. Lin, the patient visited her, and we have the good nurse for good translation. Okay, in Switzerland, they are familiar with the other foreign language in Chinese, in English, but most majority of the patients still using the Siswati, the mother language. So we need to talking with the nurse with English and translated by him, and go through. For example, did you heard it? So he will be something like that in Siswati, and the patient will talking a lot to express his discomfortable headache or mouth ache or carry or something like that, and then nurse will talking with our doctor in English to say, and Dr. Lin will making some physical examination and check the body, check the mouth. Finally, he will make a diagnosis, prescription medication, the drug for her, and also kindly to talk to her. You must be, you looking to her and the talking, listening in English by him. He will say, Dr. Lin will say, Google, you will be recovery very soon. You take this medication and you need to take that one after meal for the after meal for each meal. So it's 3 times per day for that. And remember to eat slowly and do not drink in the cold or ice water. It will destroy your stomach, something like that. So it's a good health education to her. And there's after the English conversation, and nurse will translate in Siswati. He will say, let's go. So he talking 5 minutes to expression. He translate as 1 minute or only 10 seconds. So that Dr. Lin always curiosity for that. Did you fully translate my word? And then the go-go fully understand what I say. He always with a question about that. But for the nurse, we have too many patients waiting, 100 patients waiting outside as a queue, long queue. So if the nurse can back home to take his lunch bags, he must finish her very soon. 翻译得非常快. Okay? In the second country, in Sao Tome Principe, 西非, they're using the Portuguese as a foreign language. So, okay, we are doctor. We still need to talking in English with the enfermero. He's nurse in Spanish, no, in Portuguese. 葡萄牙语. Okay, so still talking with English, he will translate to the patient, você bakuka or something like that. Still very short, very concise. So still we can ask Dr. Lin still raising the question, do you translate it fully and let the patient fully understand? Okay. In the future, we will go to the Somaliland, the East Africa, Dongfei. They are a Muslim country. They are just the first foreign language will be Arabic. Arabic is the first number one difficult to learn in language in the world. The second difficult is Chinese. 阿拉伯语最难学，中文第二难学. Okay, so we have the similar situation. The doctor using English to nurse is okay, and if you're using Arabic or even the Somali mother language, you're talking with the patient Sabah. Okay, so the good translation between the doctor, nurse, and the patient is important in our daily life. Okay, after the talk with the patient, then we're talking about the machine, the computer. Okay, this is the map of the Switzerland. They are just surrounded by the South Africa. So the Switzerland with a half size of the Taiwan. So we're working in the Babani, the captain city here, and the central national laboratory will be there here. So that means when the several remote area, the 地区的 local health center, 地区的卫生中心, they have patients to visit them. For example, the HIV infected patient, he needs to regularly to visit every week or every month to see, they take the drug and also check the blood to see the result. How about the result, the conditions of the HIV and the drug function. So I have to check the blood drawing. The blood will store here and transported by the motorcycle. Okay, from here to the central capital. There may be needed time about 5 hours driving. Okay, so when the specimen, the test tube to the central library, the library with the automatic machine to processing to check the data. The data will be putting on the file here for waiting for the next round of the motorcycle to transport the result back to the remote, like that, back to remote. So almost they will need to 1 month. From the check the blood, go to the center, check the result, maybe 1 hour, and then the result will waiting on the desk until 30 days later. The motorcycle will bring the report, paper report, go back to this remote health center, and then finally the patient will see the result. The nurse there will, according to the result. For example, he got the laboratory check about the patient have only CD4 lymphocyte count below 100. In normal people, we have more than 800 or 1,000 in CD4 positive count lymphocyte. So if just from the 1,000 low down to the 100, the patient in danger for any kind of infection to him. So it's an emergency. But emergency situation, when check the blood and got a result, they need to wait for 30 days. So in most situations, the patient already died because the low CD4 lymphocyte and high risk for any kind of infection. He died. You never know about the result of this. Okay, so in that moment we designed the project of the lab push. We pushing the laboratory result to the nurse. So all the nurses in the local region, they still have the motorcycle and a desk, and all the remote nurse. We give as a gift with a simple cell phone, not so smart, but it can transmit the short message. Okay, so when the data available in the central laboratory, we hire a computer assistant. He will typewriting, input all the data, go to the short message service of the computer, and then the machine, the computer will push the short message. Within 30 minutes, the nurse will get the result of the data. For example, the short message from the central to here, he can say your patient number, Dr. Mr. Lamini. He checked the blood in October 10, and now we got the laboratory result. The CD4 count is below to 100. He is under the dangerous risk. Please bring the patient back to your clinic as soon as possible to prescribe more drug, or even transport him to the central hospital for furthermore investigation to prevent his death. Okay, so the lab push can shorten the important laboratory result to save life. Okay, so this is lab push. So we're using the short message services in Switzerland to provide the remote clinic with a laboratory result. Okay. So in 5 years later, when I went to the Switzerland, still we can see the motorcycle transporting. It's the door of the central laboratory, and lab push is still running to check the CD4 count for patient. The other story in Switzerland is the ACC, Amateur Care Center. Is an orphanage. There's so many orphanages there because if their parent got HIV and cannot receive the short message or the CD4 count, it's too low. It's not a hurry. It's not in time to save the life. The father or mother will die because of HIV, and the children will become the orphanage, the poor. So the Amateur Care Center is an institute by Taiwan the Hui Li Fa Shi, the master Hui Li will teaching them, raising them, they're building a good, very good facility to help them, to feeding, to avoid from hungry, to save a life with the medication, and also teaching them with education. The Huili, Master Huili teaching them Mandarin language. They can writing. They are living a very beautiful. It's not a temple. 这不是庙宇. This is a ACC, the home for the orphanage. And you can see them. When the time up, we will go to the teaching room. They can writing by 毛笔 to writing the Chinese character. Okay, and also you can talking, listen. For example, in the toilet, the door we can see when 大小便时当愿众生弃贪嗔痴捐除罪法。Om Hamdu Dulu Ye Sahe 念3遍，这应该是一种 a kind of the spell 咒语 to let the children easily not 把便秘赶快把大便排出来。It's a spell for that. You see, they're using the 注音符号 to see, listening, and talking in Mandarin, just like us. We, TMU Fengqing, we go there in 2014. We check the orphanage, the children there. Some of the children with HIV positive. Okay, so we check them with the fluoride application and just like that. And we found they are not too much the calorie solution of them. Even they also like to check to see to take the sugar, but they're brushing very well. The Master Huili will teaching them very well. Or cleaning the oral and the teeth very well. Okay, so into YouTube you check the 非洲小和尚, you will find them. The Master Huili also teaching them 功夫, 中国功夫, 功夫 for that. He say that just practice for a show to us. Okay, like that. You see the eye. Okay, as there is many Taiwanese people long-term stay in Eswatini. The government, one of the government factory, 成衣厂, making the clothes. 成衣厂. The boss is the Mr. Fan. In 2009, I was married there with my wife Candy. So Mr. Fan helped us to construct or customize to making my suit. My suit and the tie and everything from then. Okay. This is a borehole, the water coming from the ground. 这一种电动的水井 with a motor to pumping the water through the pipe to the factory to work in. Okay. This is a garment factory by Mr. Fan. You see, they're very big. And also there's a candy, and also the market, supermarket very big. We have a lot of kind of food, vegetable we never see. For example, like that. I don't know what is that. Imahaya. What is that? I don't know. But it tastes very delicious, I think. There's one on the roadside. You can see vending market here, local market. It's a food. Lingugu. It's a food special mass meal. Mass meal is a major food for the African people. Just like in Taiwan, in Asia, we eat rice. 我们吃米，他们吃玉米。Okay, and the 玉米, the maize will grinding as a powder. It's a white one, they grinding the powder and boil with water, and we'll see. You see, the little baby will sometimes crawling, running, playing around the pot. But the pot is very hot when cooking. So sometimes you will digging or taking out, floating down that, and get a burning injury to the skin. And baby always will die from that. It's dangerous. So let us welcome the Dr. Lian Jiaen. He is a doctor and he is the first 外交替代役男. He is a roommate of the diplomatic Taiwan Youth Overseas Service. 就是台湾的外交替代役男. So I can say this is Taiwan youth, Taiwan young overseas. The youth will oversee to the countries with diplomatic relationship with us, with Taiwan. 有正式外交关系. The 外交替代役男 will go there to help us as the medical mission team there. We are the doctor working there, and the TUs were working as an internship or young residents and working with us. We're teaching them and also working together. So they are our good friend, 外交替代役男 TUs. Okay. In the Dr. Lian is the first TUs since 2001. Okay, from Taiwan. He was working in Burkina Faso in West Africa, and he has one of the idea project for making a borehole. So he has a borehole project for that. After that, in 2008, when I go to Switzerland, also I pick up received the borehole project to working there, and finally, after I'm leaving, so in 2014, I'm back to Switzerland to check. Still, the working borehole is still working there to help the patient, help the people, the children, with a good health for the washing the hand and to take the food and cleaning food, so to avoid an intestinal parasite infection. That means if without the borehole, without the clean water, we see as we know, the borehole water is coming from under the ground with many filtration, so it's almost sterilized, 几乎是无菌的 the borehole water, 水井是非常干净的. Okay, it's not an open borehole, so it's closed system. So the 非常干净的水 clean water can wash the hand to. If without that one, the school children will contaminate by the faces, by the food, by the hand, by we got the parasite, intestinal parasite, and finally with diarrhea, 拉肚子, vomiting, and sometimes the age below 5 is very killing disease in Africa region. They are all die from almost of them will die from intestinal parasite infection. So we know, the Dr. Lian know, and we also know, the clean water from the borehole is very important to save the life of the children. Okay, so like that. Okay, from the borehole with clean water. The borehole is what my first time to see. What's the borehole and how the borehole is making. There's a machine digging, drilling very deep to the ground, and until going to the water line, water layer, and water will go out by hand pumping or by the motor to suction it out. Okay. Then how about the depth? According to the geometric situation, sometimes maybe 30 or maybe 100 meters in depth. That is very depth. So, by the geologic specialist, how to find the water, underground find the water. Okay, I follow her. We all follow him, the specialist, to see where is the water. Does he can see through the ground to find the water, or just by smiling, or by the kind of the water witching? I heard about the story in Africa. Africa people, the witching, they can use the stick, the Y-shaped stick, they hold it like that, and the tip will point to somewhere. if you go through somewhere and the water is under the ground, the stick will go down to check that one. Thank you very much. Okay. The specialist, Mr. Mapusa said, no, never. I just came using my knowledge to see the mountain, to see through the mountain, to see the tree, to see the grasses, to see the ground, and I can determine, yes, here is a more best position to try to dig it with the machine. So they're calling the machine to come and using the machine Mercedes to find in the borehole. Yes, sometimes you will fail. Go to the 10 or 20 meters, nothing to find. You will go to try to the other way to see. Okay. So this is one of the borehole made from by Dr. Mapusa. Okay. And this motor go to the down, the water will go out through the tap. We can switch down and use the water. And behind this primary school, the classroom, and behind the borehole, there is a toilet over there. Okay. The next topic we're talking about HIV infection. The human immunovirus will infect people through some mucosa or blood. For the medical staff, the most dangerous thing is by the needle stick. Okay, puncture there, the virus in the patient's blood will go through our blood. Okay, so the transmission was between the blood by sharp needle, or between the male and female, or male and male, female and female, by unprotected sexual intercourse. And also, the mother will vertically transmit it to his child during the delivery of the boy. Okay, so that's the route for the HIV transmission. So, as our medical staff, we will not with the other relationship with African people, and also we only have the chance to get the risk by HIV infection is through the needle. So we need to very carefully to doing the surgery, during the injection, during any short instrument. We need to very focus, concentrated, and very carefully. Okay, and then we can avoid to get an HIV infection from them. Okay. So if you got an HIV transmission, for example, an unprotected sexual intercourse relationship, and then finally maybe many years, he still doesn't know he got infected, and without any symptoms, sign, and until finally from the blood, the T cell, the CD4 T cell will down to, because the HIV virus will destroy the CD4 T cell, and until below the 100, and then the patient will go into the AIDS stage and impending to die. Okay, with a lot of the infection to them. Even cancer will occur on them. Okay, so how to prevent HIV? Just like we prevent the COVID infection, we have the personal protection with the mask, with the goggle, with the hair protect, the glove with a double glove, okay, to avoid sharp injury. For him, he's not covered her hair, so he need more protection from that. Okay, during the cleaner instrument, especially the sharp instrument, we need to focus that. Okay, for the injection, for example, local anesthesia. So we have indental syringe. We have that one with a cap after injection, and then we can't go back recap with the two hand. You will sometimes will inject yourself. So always will put in the cap on the table, using one hand to recap the dental syringe to avoid the sharp injury. This is number one important for that, to avoid the HIV infection. Okay, let's go back to the food and the parasite. The malaria is one kind of a parasite. So with as a mosquito nest, we can prevention from the mosquito bite. And also we have clean water, so the clean water can avoid to taken by meal, by hand, so we can avoid by parasite. All the parasite is preventable. We need to focus about that. As early mentioned about that, if the malaria infected, we got some discomfortable. Okay, after the short break, we're back. Okay, so next we're talking about the mosquito nets, and if you got malaria, will be very sickness, got a fever or got something discomfortable. So we need a rapid test to make sure is any problem to us and get medication to save our life. Otherwise, a lot of the diarrhea, vomiting, even brain with convulsion or muscle pain will happen. And malaria can cause him to die. It's a serious problem. Okay. So after outreach, we drive home and the people walk home beside the road. Sometimes raining, we found the cow crossing the road, so we need to be very careful to waiting for them. The cow is very big. If you drive the car with a car hitting the cow never, maybe not die. Our car will be flown over and the driver and passenger may die or serious injury. Okay. So this is an example. So Mr. December Mabuza got a trouble from the car accident. So he makes with the fracture, we can see. So after surgery, we put it all max lab and mandible bone together with a wire, 铁丝 fixation about with the occlusion. So before the surgery, you see, and 1 week before the surgery, he got an injury, and the lip got gradual healing. After the car accident, he was bring back home for waiting and painful. And after the initial stabilize, if he's still alive, and he will be brought to hospital to see our visit, our OPD, and maybe got a surgery admission with the correction of ligament bone like that. Okay. The other young lady, when she was a child, he got hit on the jawbone, broken the, I think is coronary process of condyle, and then he got ankylosis, scarring closing the limited mouth opening until 20 years old. So I'm making the surgery, cutting the skin over here to go into the skin, go into the jaw to remove the ankylose, the broken scarring tissue at the bone, and then she will try to open mouth again. In the morning, one day in the morning at 8 o'clock, I'm inside the operation theater, I mean the operation room by UK. So in 2009, the Dr. Dubé just passing the outside the window. I say, Dr. Dubé, where is our patient to be operated? He say, okay, I'm making a phone call to the ward. 30 minutes later, the patient walking with nurse, crossing the male ward and toward the operation theater. Okay. And we are in the theater to make a preparation. We have hat, we have mask, we have apron, we have boot. I love the boot, white boot very much. but one day it will be stolen by the other medical staff. Okay, the washing the hand, and the anesthesiologist, 麻醉科护理师 making the intubation, the tube inside the trachea, making a connection with the machine to putting the patient into the good anesthesia, and the patient will go to sleep, and I will operation for him. I have a double glove to my hand to prevent the sharp injury from the broken bone. Okay, it's me during the operation. It's Dr. Dubé right here with a clock observation. And it's me, Dr. Dubé. We had the panoramic X-ray on the view box and the anesthesiologist. After the surgery, the patient is gradually recovery from the drug, and the nurse, scrubbing nurse, is cleaning and preparing the instrument for the next patient. He also will counting the gauges to never leave the gauze inside the wound for the patient. So the patient is waking up. I put in some gauze to stop bleeding from the nose because of maxillary fracture. Why the UK say that is an operation theater? During the 18th century, when the master, the tutor, making the anatomic demonstration or making surgery, the students, doctors were sitting all around them, looking like the theater, to see the show, to see the presentation about that. So the UK system operation room were looking at the operation theater, watching our master doing the surgery. After the surgery, I have the operation record here about handwriting. I have the day in 2009, May 26, our maxillofacial surgeon is me. After surgery with Mr. Lucky Lamini, his name, with traffic accident 6 days ago, with the raccoon eye, open the mouth, the broken the palate, ulceration, the broken mandible, so making a diagnosis of the full one fracture and mandible fracture, so making the wire suspension of maxilla, and using the wire to suspension the mandible, and with intermaxillary fixation for the occlusion, and finally finish the operation. Signature of Dr. Tex Chilixin. Okay, alright then. So from the suture, after recovery, the patient, the bed with the patient will go through here, make a turn, go through here, from the second to first floor, without any elevator. One day I jumped to the roof of the hospital to sing in the song. No, I'm not singing song. I just say, because the raining day, the water sinking into the CT scan to broken the chip of the CT, so it's out of order. I go to the roof to check where is the water coming from. There's a linkage here. 5 years later, with a new CT scan for replacement, the one patient got the maxillary cyst around here with a tooth impacted here. So, a 3D reconstruction, so that's the kind of maxillary tumor, maybe the OKC, odontogenic capital cyst. The other patient on the Santometer Principe is not in Switzerland, so he had the left side of the maxilla bulging on the face, so the X-ray can see that the other teeth inside. I think this is also a kind of OKC as well. So, but the cyst is very big, full filled with water, so we pushing on the roof, and the floor of the orbital was destroyed. So the patient, the boy, when he showed me, he was elevated left eye. The two sides are different, so working out so well. It means that diplopia. Because anesthesia is not safe in Santometer Principe, so I make a simple operation for him, to look at anesthesia, putting with the drill punching into the maxilla. the cyst cavity, putting the pipe with the water, the cyst cavity containing fluid drainage out, maybe more than 20 cc or more, and then keep the pipe here. The tip of the pipe will suture on the tooth. He will come back every week. I'm using the other syringe to cleaning as well, and when the time pass on, about 3 months later, the whole cyst cavity will shrinkage, and amazing is eye will below down to the normal level. You can see simultaneously very well. Dr. Dubé in Switzerland working with me also in 2014, making the other surgery for the fracture patient. He got an injury, lost some tooth, cleaning well and making the surgery. Down the maxilla is a tongue. His recovery, putting the gauze in the nose, and nurses is well writing down the record on the blackboard with the name of the patient, the day, the name of the surgeon, the name of the anesthesiologist, and also how many gauzes was counted, taken out from the patient, something like that. It's for patient safety. After a week he wake up, the table will be rolling up, tilting, and the patient rolled over to his bed, and with a good safety position for recovery. And then he will bring back to the ward. Afternoon I go to see him in the ward. He's sleeping with IV drugs. Open his kidney open and with fresh air inside for good health. For the developmental disorders, there is a lot of the patient with cleft lip or palate, even until adult. So invitation Dr. Tai, plastic surgeon, go to the Somaliland, go to the Swaziland, go to the Santome to make a surgery for them. They were cutting that and making a good suture around here. You can see the lip will be returned to its normal. So you can see the result looking like that. After surgery, before the surgery, after the surgery, with Dr. Tai, with a happy mother. Yeah. And the other Switzerland girl, he got a trouble from the granular. So this means the tongue is here. Her tongue, under the tongue with maybe sublingual gland with obstruction, so the saliva, 口水, will accumulation inside or bulging to let the tongue is here right here. So it's not easy to talking or eating. So I use a needle, big needle going to aspire all the saliva and relieve the problem temporarily. Okay. The other case is a hemangioma on the left side of the buccal mucosa. So the patient, so the young patient, he bent over the mucosa to show his tumor here. You can see a lot of the tertius, the artery or vein inside. It's not easy to surgery to remove. So we prescription the medication, the corticosteroid and anesthesia. So he go to the pharmacy to buy the drug, bring back to me. I use the syringe to mix the two together and injection to every side. He's got a very, very painful, and every week he will come back again to make an injection once, and gradually the drug, the steroid inside will destroy the blood vessel, causing the obstruction, and finally the tumor will be shrinkage to return to normal. The other thing is not easy to return to normal. It must be cut by surgery. It is in São Tomé and Príncipe with a small mosquito he will bite into him. Nelson is elder brother, and Nelton is the elder brother. They are twin. Maybe 10 years ago, they are both be stung by the mosquito, and a kind of the aphantasis, the parasite go into his leg and follow the lymphatic system, causing the blockage, obstruction. Then the fluid will accumulation by the gravity of the earth. So the leg will look like that. A lot of water, 组织液完全无法回到心脏。So the fluid will accumulation here. The leg and skin will growing, overgrowing like that. We making the consultation, telemedicine, to contact with the doctor in Portuguese. So they transport them, both of them, to Portugal, and making surgery and find a cut shaping of the legs and using the other skin graft putting on over cover after healing. When he come back to Sao Tome, I visited him once. I saw he got the very slim and normal the leg and can walking as well. Okay, amazing. The Sao Tome go as the infection from the teeth. You can see the abscess, chronic abscess, and cellulitis from the maxilla, from the mandible, and our famous Oswaldo in Sao Tome. He got a trouble from the thermolar right here, and for 5 months. So initially just toothache, then gradually he found every night he cannot, because of headache, severe headache, he cannot sleep well. So the abscess and infection from here through the face to through the ear and goes so beside the eye to the temple region. So he got the whole head and face are swelling. But yes, you cannot see any difference because of the dark skin. I'm making the surgery for him, but he cannot open the mouth, so the anesthesia to the mouth is impossible. So I say, Oswaldo, you are a strong man. We can just use the local anesthesia to here, and to here, and I will make a cut to let all the abscess and bacteria out, and then it will be maybe weeks or months to gradual recovery of the wound. But after the abscess, anything dirty things out, your head will go away. He say, okay, I will biting. He's using a tree stick, biting on the teeth. I say, okay, go ahead to cut me. So I cut the 3 sides, 1, 2, 3, and using a lot of the abscess go out, white and yellow and very bad smell. And then putting the goats and something go into to cleaning, to primer. Every week, every day he come back OPD to clean the wound. I do that for him. And after 1 or 2 months later, as usual, the skin wound is healing and no more headache to him. The final problem is because long term the abscess, the muscle around the face was scarring and destroyed. So I say, you are the fisherman. You can make a wood wedge. He cutting a wood wedge by himself and using that to go into the digging, to try to exercise to open his mouth widely, so he can eat something. Small fish. Okay. The other lady in Switzerland, when I first arrived there, she was admitted at ward. The doctor invited me to see her. I say, look like an infection somewhere. There is swelling on the right side or on here, but the neck cannot. When I touch it, it's warm or hot. But for the scalp, for the color of skin, I cannot see any differences around here because the dark skin, I cannot see the reddish like that. Usually the infection, bacterial infection will be 红肿热痛, so it must be red, but I cannot see, it's difficult. According to CT scan, there's a spine, we cut through, we cut horizontally here, we can see there's an airway, but surrounded inside the muscle with a lot of gas or abscess inside. So it's a necrotizing fasciitis. The bacterial infection from the tooth go down to the neck to go to around the airway. It's very dangerous. So finally, 3 days later, he go away. Yeah, we are not hurry to make the treatment to save her. In Switzerland, if you want to see the giraffe, we need to go to the wild animal garden. So our Taiwan youth overseas surfaces, me and Candy, we go together to see. Okay, so there's the Lion King in Switzerland. Here's the Lion King over there. We the guide drive the car, drive the jeeps, the car, bring us to there. Finally, we found him. Right here, he's alone. He's watching for something. So we stay here, keep quiet, take photo, and also discussion for each other to say, why Lion King? What are they looking for? Because we're so louder, so he go back to say, ah. And then we are go back for 10 meters, wait and see. And Lion King say, okay, I'll keep going to looking forward what I see. So he's so alone, stay there. Okay, it's intercity transportation by bus. So the boy is sitting here for waiting. Amazing lady, they have the hand carry. He can carry everything, even the baby or food or banana. Okay, so in the morning the elder and younger sister will bring a blanket of the clothes. They're dressing all together and very happily go to the riverside to washing. So they're washing by using the river, they're talking, exchanging everything, the news. And during the sun shining, the whole clothes dressing, were putting spray down there. They were drying by the X-ray, ultraviolet ray by sound. It's free. Okay, but afternoon, the storm will come, and rain will fall on the dressing, so the rain is washing the clothes again. And in the evening, the sunshine still cover the whole dressing. It will dry again, and the happy lady will bring all of them go back home. In 2020, I found in TMU, yes, maybe one or several smart students come back from the Switzerland. They learn from them to cleaning their clothes, jacket as well. It's ultraviolet sun ray is very clear. The King Swazi Third International Airport was constructed and started to working since 2015, so we can fly through, fly in and fly out into their well. But actually, it's just a project. They're planning to making the airport looking like that. But actually, the airplane was only finished part of it. The rest of it, they still need a budget. The glasses with a blue sky and very beautiful cloud. It's a Dr. Chen, also dentist doctor. Is go with me in 2014 to go to Switzerland to visit then and also visit the TB hospital, tuberculosis 结核病的 hospital. Okay, there's a doctor working there. They are talking in detail. The business working with her patient, and as we see a lot of the paper chart here. Usually the TB patient will got a hidden loss because the natural course of the disease. So social sign will be designed and put down published on the wall of the hospital. The OPD patient will see and expression something to his patient, his doctor. For example, thank you very much. I got very hurt. My heart is broken. Something like that. It's outside the TB hospital, the ward with a good ventilation of the air. The SWOT HR EMR, the 电子病历. So we have a lot of the paper chart. So sometimes we cannot find the patient. For example, when the patient finish the visit, we writing down everything on the on that, and then step together. The patient will bring all of them the chart back home. Next time when he visit, we'll bring back. But we're looking like that. All the words and all the paper or oily, and we want to write down something is sometimes difficult. So we develop by computer to record the chart, medical chart. So it's the HR, and also the paper cannot identify the patient, only writing down a name here. So we're using a fingerprint, 指纹 for identification of the patient. Especially in the operation record during the hospital. After the surgery, you see, it's written by me. The patient go back home. So hold the record will keep in one secret area, secret place in hospital. And when patient go back to OPD to follow the wound after surgery, we never see the record during the hospital. So it's a trouble to us. So we also making the computer to record for the operation record. So when the patient come back to the OPD after the surgery, after discharge, we can know, oh, I'm making some surgery for you. Now we will follow up the cyst and follow up the bone fracture, something like that. It's a nurse in Miss Magusa in the Babanigam Hospital working with us. It's Candy. They are good friends now. We're driving car across the road, and we're going to go back to my home, our home in Swaziland, with the shining. At night in the winter, the temperature very cold, almost maybe 5 or 2 Celsius degree. It's very cold. So at night, Candy and me will surrounding. I will making a fire by wood. And we will go also lie down in front of the living room, and in front of the shining, so we can get warm and can sleep well. It's our home. So because we have the very honey home, sweet home, so in 2009, 12 is 6, Tex and Candy, we are married in the embassy of Taiwan embassy of Swaziland. 我们在大使馆结婚的。This is the Mr. Tsai, the ambassador, 大使，蔡大使本人。Okay, and also our Taiwan young boys, they help us. They can eat well during that day, and they help us to preparation for all the stuff or the setting. For the wedding ceremony, for 婚礼的准备，都谢谢义男们。one day before that, we just rehearsal for the ring putting in the ceremony. And the Candy say, I will give you the middle finger. Okay. During the day of the ceremony, our doctor and our staff all bring me a cookbook. They say, "We wish you have a good cook since the day." Okay, in Switzerland. Golf yacht is me, and it's Candy. We have our puppy dog. Raising is a big dog now. A big giraffe right here. He's standing on South Africa airport. Okay, it's our car. This is our dog, Winner. His name is Winner. Lovely dog. He likes sunshine. Me too. The handicraft it's an impala over there. I bring it home. So at home in Taiwan, we have giraffe, big and small, and also impala. They're all together with me. Impala, 羚羊, really, he can fly. 飞跃的羚羊. So if we driving car through the road beside the animal garden, we need to very focus on that. Okay, after the Switzerland mission, and then we fly directly from South Africa to the Germany, and then go to the Portuguese, and finally to the São Tomé and Príncipe in West Africa for the next second mission from 2011 to 12. It's also the Taiwan Medical Mission in São Tomé. So it's a Mission Medical de la República de China, Taiwan. It's me. It's Candy. It's the Dr. Zhu Zihong, and the green color. The young boy is the Taiwan youth. 替代役男. Okay. We have our team with a new puppy there. So the first day I'm in São Tomé working, I preparation for the 口腔卫教宣导 the DM putting on the wall, and also for a brief introduction. What is me, and I'm here, and my master, my boss in Taipei, Dr. Peng Yi Shi, we together, and we are here for help the people in São Tomé. It's a sister Paulina, she's a nun, 修女, Paulina 婆婆. What the problem here? We don't know. According to her, he say 10 years ago he got a mosquito bite on the buttock, and the wound never healed. So he every day he go to our OPD. We're making trench dressing using gauze to debridement cleaning for her. He got suffered very a little painful, but he can still come to us every day. How about in the weekend? During the weekend, we drive the car with our young boy, Taiwan youth, overseas 替代役男. Taiwan youth. We over go to the sister's home, Paulina's home. We come to here to find her. He's not here. He's just beside the beach to washing his fish and the vegetable, and then bring back to here to cooking. We're waiting for her cooking, and also preparation for the wood trench dressing for her on the bottom. On that day, each time we making the trench dressing to her, she always sing a song like oh la 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 la, something like that. I'm not never making a record. So one day I asking Dr. Zhu Zihong, what does Paulina say during the singing when we make trench dressing? He must be very suffer from the pain. Dr. Zhu Zihong say, yes, Paulina say, oh my God, oh my Lord, why you always let me painful like that? I pray for you, I pray for myself. I wish everything will finish very soon. So 1 year later, the Paulina never come back to OPD again. We saw on the news and read by Mr. Izadi. He said that Paulina was passed away. Yeah. Okay, Mr. Izadi is our good friend. He's a good interpreter to making translation between the patient and us. So his patient is Candy. He says something to him in Portuguese, and he was talking with English to me. So I would know, oh, the patient with some problem with caries is painful, so we will do something for him. In this scenario, I talking to Izadi for example 1 minute to explanation something, and Izadi will say about 5 minutes or 10 minutes to the young lady, say louder. So after that, after finish the treatment, the two girl is a lady of her. Okay. After they leaving, I asking Izadi, why I talking 1 minute and you can translate 5 minutes or 10 minutes? He say, hey, that's a secret. Okay. So one day he got a problem, the toothache, 1-8 thermal. So I teaching him and making a local anesthesia and remove the tooth by him. And during the same time, I will talking to him to say, let him know about patient's feeling about anesthesia, how to reduce the pain, and how about the pushing, the movement, the feeling about the patient when the tooth will come out. So he know about it very well. And next, he will do anesthesia to his patient. I just observation him, but just watching him decided with the guidance. And he tried to remove the tooth. The same side, the ophthalmal, he gradually move the tooth, move. 10 minutes passed, still there. Okay, so I go there to say, Izadi, you should look like that. I use my little finger to push the forceps, and then the tooth come out. He's happy. He say, this is my first teeth removed by himself. Okay, he say, you got it? You can gradually find that. Okay. The patient's girl, he always want to eat my hair. Maybe he's thinking, this guy is looking so different today. Okay, after several years when I live in Sao Tome, still our member were looking to study to doing the treatment to patient, scaling, tooth removal, or even operation OD to 补牙, operation dentistry as well. Okay, this is a laser acupuncture there. You see, the boy can hand carry the banana and every food. Either the lady or boy can do as well. So the lady will always carry the most heavy things. It's heavy stuff. There's water inside. The Dr. John Liang, he come with us together in Sao Tome. Take an X-ray for patient. We always like to show without a view box, so we need the sunshine to see every detail. The sun is our good friend in everywhere. During the weekend, I have Jaganda. Mr. Ashwato, I cut the head to remove the abscess from him. He making the Jaganda, a kind of the 独木舟, or the 排法, like looking like that, with a 4 big tree stacked here, tied together with a small table. I can sit in there. I teaching them making a double paddle for kayaking. 在台湾我们学过了海洋独木舟，所以它是双桨，两边一边各一。但是对于双桨，对于这个当地 local in Sao Tome, they're using different. Okay. Mr. Katone is the Dr. Zhang Tuanzhang's patient. He got problem on the leg, so he working on the coffee mountain. He raising in Sao Tome with a good coffee making here. They're raising a coffee tree, and they're also cooking for coffee. Dr. Zhu Zihong, it's Candy and me. So we all run together. During the weekend, always we'll go to find Katone. He will give us the good cup of coffee to drink. Okay. In 2012, before the young youth, Taiwan youth will come home, also for me. So we all together with the demonstration, we are so happy in Sao Tome and Principe. Okay. We have the Oswaldo, we're doing the surgery, draining the abscess for him, and also we become a good friend. He making a good jacanda, the tumuzo for me. Okay. The fishermen, Oswaldo's fish boat, we're looking like that. They use a single paddle like that, different than us. We have a double paddle with a right side, left side, right side, left side, with more efficiency to paddling. But he's an expert to fishing, so we buy the fish from them. They're making a sashimi for us, 生鱼片. So one day before we live in Sao Tome, we go to the southern part of the Sao Tome, the Banjiu-dao, for traveling, for relaxation. So it's so big, so white, sandy, the beach. Before our leaving, we were making a certificate for Hamilton as a good dental technician, and also for our Mr. Izardi for certificate oral hygienist. They can do in the simple extraction, scaling, and OD for his patients. After we're leaving, he's still working in Sao Tome OPD as well. Hamilton also. Okay, so that is the young lady. After that, the Miss Go will bring all the young boy from the Luxing of TMU, go to the Sao Tome to see. No, sorry. Go to the Switzerland to see the water, to see the patient. So 2012-14, we are in Switzerland with them. Go as a team to leading them. Dr. Chen Dexing is also there. Me and Candy, the ambassador, Du Tuanzhang, Liao Tuanzhang, all there. So that is a Taiwan embassy in the Kingdom of Switzerland. Another day. It's also our wedding day, our wedding place there. Okay. Driving the car on the left side is a UK pattern. In the outreach there, the side is here. The patient, we are inside for visit the patient, help them prescribe medication, and patient will waiting outside at a long queue. Okay. Some boy with tooth problem, so they have a local hygienist doing a simple odontectomy. I'll go there to see. Say, doctor, do you have any, if any necessary, just call me, I'm over there. He say, okay, he's doing the odontectomy very well by himself. The junior high school lady. One day, go bring us to the junior high school to making the fluoridation to apply that. So that's the most important thing. The fluoride, if it's swallowing too much, it will go in the vomiting, nausea, vomiting as well. So, but the fluoride can prevent the caries. So the teacher, they were teaching to our students, and also writing down in the Siswati language to precaution the don't swallowing the fluoride. Okay, and but this young boy still got a stomach ache and sitting there to waiting. We just walking here and observation him. The other lady also vomiting here, so we get some water to her and waiting observation for a gradually recovery. After he stay here for 30 minutes and go, he's fine. And the young boy stay there with us for 3 hours, but still not okay. We say, Putty, is there any problem to you? Are you okay now? He's awakened, but he didn't say anything to us. So we're thinking, he's not a problem from the stomach, he's a problem from the head. He wants to take a rest today because of us. When the bell ringing, everybody stand up, but not the boy. We're thinking, what happened to that? We follow them to find, oh, there's a brunch time. They go, all the students go there to find their food. Yeah. After the mission, the go back home. We are transferring the South Africa airport, and we go to the Italy to find the Roma with the 中华民国驻教廷大使馆 in the Vatican. Okay. Several years later, we also come on the same year. We also come back to Switzerland again. In 2014, I go there twice. The second time is for the Royal Health Check team. So all our team, leading by Dr. Liao, Dr. Du, all together to see His Majesty 斯瓦基兰国王，他本人。And make a good photo. I'm not there because I'm working busy for a dental chair. Okay, and the doctor visit the royal family for health checking, and also sometimes we'll go to see the giraffe. Dr. Lee and Dr. Zhang we are doctors to think about what the causes or pattern of the death of the giraffe. Just see the teeth, to see the outside, to see any bone fracture. But when I see on the back, we can see them. They are looking for food there. So finally we say, okay, no, just leave it alone, we go. We leave the food for them there. Swazi is a rich Swazi, a long way to go. And during the family, our royal family health check, since the 2013 to 19, every year we will go there once to visit His Majesty, and also led by our doctor and our cleaning dental chair preparation for him. It's a briefing situation, so our leader will go through all the forces. He will say, Our Majesty, today our program is to check your health, and we have the blood pressure, vital sign, body weight, body height, to check is there any weight gain for you each year. You need to diet control your body weight and also control well your blood pressure as well. Okay. And then finally, the last one is to go to the dental department for the cleaning. So I'm making clean all the chair and the instrument, also with the blood sending machine and ultrasonic machine for scaling. It's a chair for the emperor. When he needs very clean, he is clean. Okay. Yeah. This time I stand here, all in the front of the Martini Clinic for the royal family. It's also kind of the 到宅服务. Okay. After the finish the health check today in 2018, His Majesty will group photo with us. The leader is Dr. Dai. I'm here, and okay. The other next year, 2019, after finish that, His Majesty and Dr. Du and where is me? I'm here. Okay, right. This is Dr. Zhang right here. And this year is very special day. After the health check, the worry day, another day, so His Majesty invited us, all of us, the boy, come with him together to hunting. So Dr. Dai here, I'm here. So also the dressing, the traditional dressing is a gift from His Majesty. We are very happy like that. The lady will dress in like that, will show the right shoulder. For the boys, will show the left side of the shoulder. Okay. When come back home, my professor mentor, Dr. Jack Lee, say, this text she always find in Africa. When he coming back, he want to find something, some place in Taiwan looking like Africa. Okay, so TMU have wrote 2 books as a record for us. One for the Switzerland, the other for the Santander Principe. Okay, so this is Dr. Stone, and this is me and Oswaldo. This is Dr. Zhu Zihong, Dr. Zhang Liang, and okay. And according to the text, you can see it's me, and this Dr. Liao, and the Taiwan Medical Mission here. I'm here. I found that Dr. Lin teaching us for dentist home visit. For example, the cerebral palsy patient, the boy, cannot washing teeth, brushing it by himself. So the caregiver will be very nicely, gently to try to open the mouth and brush well. Otherwise, he will bite you. He will bite you. He cannot control well because of motor neuron disorder. Okay, and in 2015, my father was under the bedridden because of stroke. 因为中风卧床2年，然后过世。During the period, sometimes he will live in some admission in the Wanfang Hospital, and we will bring him to the 8楼 the garden, 菜园. Okay, the happy garden, the happy farm will be here. 2021, I was be transferred to Wanfang Hospital, so I will go there to memory my father there. So because my father, since 2015, I start to dentist home visit for DOH for disabled patient, stroke, 中风，先天性疾病、肢体行动不便、头脑不方便等等，脑性麻痹、渐冻人 all of them will be stay at home and will be ranged to their home to visit. You see, all staff, our doctor is me, we're all around her chair where and making the scaling, tooth extraction, and teaching her to brush into teeth well. Okay. And I'm here, then Mr. Huang here, and we will with the scaling machine, and also we have the suction machine and the vital sign monitor, and also we have the AED for in case an accident happen, and also we have a good big tank here. It's an oxygen bigger than me. We bring all of them stuff to here, to his home, to her home, to making the dental treatment. His older sister here. Until 2021, still we visited the same patient, Mr. Huang, there to make his scaling. Several tooths was already removed by me. So I say, Ms. Huang, you will clean your teeth well, because now you just only with 5 teeth. It's easy to get clean. Okay. She smiled to me. The other lady here, he got a dementia, so we need to teaching her family to how to brush teeth to her very well. The elder sister, her daughter. Okay. So the patient, when he can listen me, we can say, we're teaching her and teaching him to say, now I want to clean your teeth well, please. Okay. But the other situation is the patient cannot follow my order. Just okay, just look at me. Okay. Even if he doesn't say we can use our finger, curve like that, going to the mouth to show the teeth and brushing well. Just like that. Gently massage the face, that the patient will be feeling comfortable. Even he cannot talk with you anymore. Okay, the finger going through, and using the finger, using the brushing, massage the face, something like that. The patient's family always will be making a record for easy to remember, because after the teaching, the family will daily care of her or his mouth, teeth, every day. By then, next time when we visit them, we will say, okay, show me how to use clean her teeth. I will watching you. Okay. It's one of our grandfather sitting there with the urine blade, Foley, 有尿管 with the empty tube 鼻胃管. Okay, he is lost conscious. He always doesn't know. Outside his window, the flower is so beautiful and changing by season, by years. He never know. One of the patients right here, he stay in the Battles Yugang in the northern Keelung, and I'm very happy because each time I go to his home, I will bring the stuff. I will jump outside to see the sun, to see the ocean, and also see the Keelung Island, Jilongyu. I was talking with him. Mr. Lee, you see, I make a photo and show to him. Today, your Keelung Island is so beautiful. It's a beautiful day today, and we wish we have the beautiful. We have bring a beautiful cheese for you today. He's very happy. Okay, this is when through the window can see Keelung Island. The Battles Yugang is the fish boat go outside at night for 钓小卷. They have the land very big, and also we stop three together with a suitcase go there. Okay, the suitcase here, the Jilong Battles Yugang is there. It's the Miss Wenqi. Okay, almost we will go through the final several messages. For example, which one in our previous question, which developing country with which kind of the transmitted disease is an intestinal parasite infection? Because the clean water is not easy if without borehole. Which one is not easy to transmit to medical staff? Yes, we have the clean water. We doesn't eat with them together, so it's not easily transmitted to us. HIV could, but if we don't sharp needle injury to us, it is okay. And which kind disease can be cured? Yes, parasite infection can be cured by medication, antibiotics. But HIV could not. How about malaria? Malaria can be cured by 青蒿素, tasmanian, or chloroquine. But avoidable is not easy. You cannot. My skin and my smell is easy to attract the mosquito. Mosquito love me, so okay. This is my QR code for my Facebook ID. So if it's still interesting, could you follow us? You can just check in that. When we come back Taiwan, we are very, very appreciate for the Taiwan National Health Insurance. 健保真好 because 全人照顾 holistic total patient care, and we have good water. We don't need to go 1 hour to bring clean water back. We just open our tap water. We can drink everything. And if got trouble, we go to hospital. In just 1 day, we can finish and get any medication. But for the patient in Sao Tome or Swaziland, they are not easy to approach in the hospital for medical help. For that example, the patient got car accident, he bring back home, waiting for 1 or 2 weeks, but maybe he will die. If not, he survived from the first injury, and maybe he will bring to our hospital to fix the broken problem. So this and all the treatment or surgery are paid by themselves. So if they have no money, they will stop the OPD visit and go back to earn the money and go try to hospital to visit us again. So we have the coverage of our health insurance, that's fine. Until this year, I've graduated from the Translational Medicine PhD program. So it's one of my mentors, Dr. Wang Haoqing 老师, and also I'm working for biomedical informatics, so I like your computer. The Taiwan use the 替代役男 in Sao Tome and Principe. They are happy for that. It's me. I'm looking for them. I know they are so happy because they will come back home, Taiwan, next day in 2012. Okay. If still your elder brother in your home, 如果你们家的兄弟好朋友们哥哥们准备当兵，请去内政部的役政网站有一般替代役申请。You can apply for the Taiwan Youth Overseas Services, TUs, for the 外交替代役男 ，OK? Just start from the next month. Only with duration 1 month to apply for that. So if 你们家人朋友们有人男生准备当兵，今年，那么请记得来去申请这个外交替代役男 TUs will like the Miss Dr. Lian or like the Dr. Zhu Zihong. They were all working with us together in the Taiwan Medical Mission in Africa. The other good news is I worked in South Africa, the Swaziland, and also West Africa, the Sao Tome and Principe, and from this year, we will departing to the Dongfei, the whole of the Africa, the Somaliland, right here, the green one, to 成立 the Somaliland Taiwan Medical Mission. We'll be there. So we hope we can see you. You guys, if interesting for the TUs, welcome to join and come to there to find us. Okay, in local mother language we say Siabunga Kakulu in Swaziland, in Masebagu in Sao Tome and Principe in Portuguese, and also in Arabia. I do not know how to say. By Google Translator in Somali, maybe they say Ade Ayat U Matas Infinity, something like that. Okay, so finish today. Thank you very much.